today. We're really excited to hear from Aila, what she's got to tell us about water law. I know everybody's excited for this session. I'm really excited for it. So I think I'll just go ahead and jump in. I don't think we have any huge announcements now. We'll go ahead and give a few announcements at the end of the training. Thanks so much. Over to you, Aila.
Great. Hello, everyone. It is great to be connecting with you all again. I am excited to be chatting about diving into water law research. I am joining you all from Indianapolis. Ooh, I'm hoping, are my screens showing up okay for y'all?
We see we don't see the presentation. Oh, now we see the presenter view. So the wrong screen.
They gave me a new monitor, which is very lovely. But
that might be, yeah, there you go. Perfect.
Nailed it. So I am joining you all from Indianapolis. I am a professor at Indiana University's McKinney School of Law. It is starting to feel like spring here, where I've been hitting 60-degree weather the last few days. In fact, I have a Hoya plant in my office and it bloomed. So I was really excited to see that. I thought I would also share with you all a little bit about the Iranian New Year. I'm an Iranian American, and the Iranian New Year is Persian New Year, our biggest celebration. And it starts at the moment of the spring equinox, which is going to begin in the evening of Tuesday, the 19th. And so this is the decorations that we put out. And so I often share a little bit about the New Year with folks because I think it's really bonkers that in so many Western countries, the New Year starts the middle of winter. And the symbolism of these decorations and for the entire holiday is about getting rid of the sickness and illness and despair from the previous year, burning those and starting fresh. And so for folks who have found that 2024 has not served them very well, I really invite you all to celebrate Nowruz, the spring equinox, with me. Here's to a very fresh start, happy, healthy year for all of us. So with that, let me tell you how we're going to be spending our time together. I'm going to be starting off with an intro to water law. I'm a little embarrassed even to say this, but I am not an expert in water law. I am a public health attorney with expertise in tribal public health law issues and federal Indian health policy. I've done a variety of projects and research and collaborations on all sorts of public health issues. Water law has not been one of them. Why do I still dare to sit in front of you all and share a little bit about what I do know about water law is because I am an expert in developing public health projects, how to develop research questions, what does that legal research look like? And I am going to be, in a lot of ways, walking along some of this journey alongside you all for the first time, with hopefully the many projects that I have done on various types of public health issues that we can talk about best ways to kind of narrow the field. So I'll give a super brief overview of water law. If you ever want a little bit more, I've done so much research over the last few months. And so I feel a lot better versed even than I did half a year ago. But we really want to just get an idea of what the legal research landscape can look like so that we have an idea of what we're going to prioritize in terms of a research project exploring water quality issues. And then I'm going to pivot into a case study of where we are trying to find out, well, what do we know about, and in this instance, lead and water quality, and what does the law have to say about that? And that'll give us a good idea of why developing a research project can be really complicated given the volume and complexity of various laws across different jurisdictions. And then I'm going to give us hopefully what will be a hands-on exercise where I can start doing some legal research alongside you all. I'll pull up my preferred database and some of the other ones, and we can start exploring what are some of the priorities that you all have. So what I want us to take away from our time together is not that you all are going to be able to go give a water law presentation yourself, but that you understand that there's multiple jurisdictions that are going to have laws that are going to come into play in our research area. We are going to talk about some of the big hitters in terms of laws at the federal level and what that means in the context of preempting action at the state, local, and tribal level. And then we're going to get I want you all to be able to generally have an idea of what the research process looks like when you have identified your own research priorities and be able to prioritize them based on the amount of labor that's going to go into that research project. So let's kick off water law. Water comes from a lot of places, and the law will often treat the different sources of water and regulate them differently. And so, as you can imagine, even with a few minutes, a few days, a few weeks, a few months, we wouldn't be able to explore all the many issues that come into water quality, water access. But this is already going to give you an idea of the complexity of the legal framework in which laws are impacting these issues. Whether it is confined surface waters, whether it's oceans, when we're talking about groundwater, when we're talking about delivered water, that all can have a different legal structure that's going to govern it. There are a few things to know about water law generally. I am pulling these bullets from my water law class when I was in law school 10 plus years ago. And they still ring true today. My professor is Adele Amos, an expert in water law, has worked with several presidential administrations, anchored us by telling us that water law is a branch of property law. Now, we could have a really rigorous discussion on the ethics of whether water should be considered property, but that is how US law treats water. We are also have to understand that as a general matter, water law is an issue of state law and tribal law. I'll talk a little bit about those complexities here shortly, but the federal exceptions end up swallowing the rule, and they really preempt the field in terms of a lot of state, local, and tribal action. There is no national water law policy. The federal laws, regulations, policies, guidelines are policies that govern one discrete area of water law, but there is no such thing as a comprehensive water policy. And that's why state, local, tribal governments are so important within this framework of water governance, because federal law doesn't do everything, and many would say it doesn't do everything effectively. The other piece of this, and it's one that I won't be speaking about very much, although I'm happy to give some additional resource on this. This is something I do cover in my property law class, is that the public retains certain rights and interests to water rights. And so what does that mean for public access, for example, to beach, even though that property might be state-owned or privately owned? So let's talk a little bit about federal law. Federal law is going to be our governing body, and it's going to preempt state law, and almost always is going to preempt tribal law in this area. And so you might have treaties, whether they're international treaties between the US and Mexico, whether they're treaties between the United States and tribes, that can govern certain use and access to water. There are interstate water allocations, so compacts negotiated by states or prescribed by judiciary or court system. There could be statutory, so congressional legislative action that also does allocation across states. We have this idea of navigation servitude. This is coming out of constitutional principles of the federal government being able to regulate the navigable waters of the United States, because that is in the interest of commerce, that especially if we anchor the early days of the United States, that how much of commerce was done via waterways. We have federal reserve water rights. That's going to implicate tribal water rights access, but also water rights for national parks, natural forests, etc. And then we'll have a body of federal legislation and regulation, so congressional action and subsequent agency action that's going to preempt state law, and in the context of water law, often going to be preempting tribal law. So just a couple of examples of truly more than a dozen pieces of federal legislation that I could highlight, just to give an idea of the ways in which the federal government does regulate water. So Clean Water Act is going to be one of our heavy hitters. It's going to apply to waters of the United States. So that's going to be interstate waters and any navigable waters. The goal of the Clean Water Law is to limit the discharge of pollutants so that the nation's water supply can be protected. And the way it does that is through three primary components. There's going to be limitations on pollutant discharge. There's going to be water quality standards, and there's going to be wetland regulations. And that is, in practice, becomes a really complicated administrative agency patchwork of different permits that might be required in order to pollute, among literally thousands of other regulations. We also have the Safe Drinking Water Act. I know drinking water quality is of particular interest to this group. That's going to be regulating rivers, lakes, reservoirs, springs, groundwater wells that serve more than 25 individuals. So that's the statutory threshold. And it allows the EPA to set standards regarding drinking water quality. And that is both from natural contaminants. So you might think of algal blooms, so potential harmful algae, but also man-made contaminants. So discharge from manufacturing, pesticides from agriculture. Safe Drinking Water Act allows for state regulation and enforcement of standards, so long as they meet the federal minimum. So this is an example of one of several different types of federal environmental laws that allow states to take the primary role in actually implementing and enforcing the federal standards if a state chooses to do so. And the idea is they just need to meet whatever federal minimum is established by statute and the corresponding regulations. So just to give you all a complexity, this is a brainstorm of scratching the surface of the number of federal agencies that are coming into play in terms of federal administrative authority in the context of water law. They are enabling authority, so the statute that through Congress that gives that agency authority to act in that water issue. So that could be, for example, the Clean Water Act, Safe Drinking Water Act. It could be the American Water Infrastructure Act, the Soil and Water Resources Conservation Act, the Indian Sanitation Facilities Act. Indian Health Service has authority to build sanitation facilities both for drinking water and for sewage, and that's authorized under the statute. The Endangered Species Act actually is a pretty heavy hitter in the context of water quality and water protection, because listing endangered species means you're going to have to protect their habitats, and so that's going to impact what can be done near these water supplies. But like I said, this is just a snapshot of some of the agencies and statutes that give them that authority. At the federal level, we have this extra layer of state and local agencies that are going to come into play. So State Water Resources Department, state engineers that might have permitting requirements also for discharge. As an example, adjudicatory bodies, so certain courts of law that focus on water settlements when there is really complex cases on competing water rights on a single body of water. At the local level, you'll have public utilities who are going to be sourcing much of the drinking water and then water for sewage and other systems, and then also water districts. And then there could also be irrigation and drainage districts. So lots of players at the state and local level in terms of the government agencies. But we have the added layer depending on the jurisdiction. I know this is a complicated chart, but again, we're just trying to get a snapshot here that you could have certain private carriers, for-profit carriers for water to source water to certain areas. You could have private, not just public water utilities, but also private water utilities. That's been becoming increasingly more common as local governments have been strapped for cash. And so lots of folks, conservancy districts that could come into play, really wanting to protect these sources of water. Lots of players that can come into play that makes both the regulation and implementation of those laws really complicated. There's two primary areas of regulation at the state level when we're talking about water access, and that's going to be surface water regulation and groundwater regulation. So there are a few different models. There's actually more than the 4 that I've shown here. There's some subcategories, but I think this gives enough of a high level idea of what those categories are in terms of how surface water, so lakes, rivers, can be regulated across states in the United States. So we've got riparian. So we're going to be talking about adjacent, owner of adjacent lands to that water source has the right to reasonably use the water. You're going to see this model, riparianism, more common on the East Coast. Regulated riparianism is this same standard of adjacent landowners have a right to reasonable use, but that jurisdiction has also added a permitting system so that the government can assess whether that use is reasonable through that permit application. Prior appropriation is the most common model on the Western United States. It's a first come, first serve model. And this is because of the history of westward expansion. The laws were developed to try to incentivize movement of settlers west. And then we have some of these hybrid dual systems of some degree of riparian law, common law coming from the courts, but statutory protections of prior appropriation. The groundwater regulatory framework, you've got absolute ownership, unlimited withdrawal, regardless of how that's going to impact other users. Reasonable use is that you have unlimited, reasonable ability to withdraw. Correlative rights, if there's a single aquifer for this groundwater, their percentage share based on ownership of the surface land. And then prior appropriation, which is another priority system, first come, first serve, and actually does not include any land ownership component. The idea is if you can build a well deep enough and angled in the right way that you can access that water, you are going to be able to get priority to that. I want to also talk about tribal law again, just briefly, given the time that we have. Tribal treaty rights come into play in terms of the federal establishment of reservations and federal reserve water rights. So the US Supreme Court has said when the federal government has established a reservation, even if they did not expressly said anything about reserving water rights to it, that by implication, establishing a reservation means also establishing water rights. And so tribal treaty rights are often going to be some of the oldest rights to water in prior appropriation in Western United States, either if under the date of the treaty that established the reservation or those water rights, or sometimes courts will just say since time immemorial, they're first in time. As I mentioned, in the context of Clean Water Act, this is also true in the Clean Air Act and some other federal legislative packages, tribes are able to be what's called tribal treatment as states, that they could implement and enforce the federal water quality standards if the federal government approves it. While this is a really great opportunity for tribal self-governance, this has actually been underutilized. Only a few dozen tribes have actually secured approval from the federal government to enforce these environmental water quality standards. And there's been a lot of literature and discussion on why that's the case. Water can also be protected because of cultural and religious protections under federal law, although federal law almost always falls short in the adequate protection of tribal water rights for the purposes of practicing traditions, cultural practice, and religious practices. And then we've got tribal law that might have its own environmental regulations, water quality regulations, water testing regulations, what you might expect to see at any other kind of jurisdiction that's regulating. Now, I want to talk a little bit more about tribal law here as we dive in deep in the context of lead law and policy. So as you all know better than I do, just how harmful lead can be, especially to children. And from the legal side of this, governing lead, just lead in water sources, is remarkably complicated. So in my research and trying to assess what kinds of laws exist to limit lead in water, you're going to see regulations at the federal, state, local level regarding lead in paint, lead in air, lead in dust, lead in soil. You're going to have some specific laws that are related to water testing. There are going to be different laws related to the lead waste and cleanup. There's federal requirements for toxic substances reporting in which lead would be triggered. States will have public health reporting. So when, for example, a healthcare provider, a lab tests blood for lead levels, there's going to be requirements across jurisdictions to report the threshold of lead. How is, for example, a child who's a Medicaid recipient in a certain state going to be treated following the testing that shows elevated blood lead levels? When are children going to be tested and screened? What about buildings? What about daycares? What about schools? What about houses? When are those going to be tested? What are the thresholds? Who's allowed to test? You could have workplace issues. So when you have to respond to lead abatement in different facilities, and waste sites, that is going to be implicating workers' safety issues as well. So just the issue of I care about lead in water is implicating here on my list a dozen, but I think with a little bit more time, we could probably identify 24 different areas that are going to be relevant in terms of, well, how do we address, mitigate, prevent, respond to lead in water? The other piece of this is not just the substantive topical areas, but we have multiple jurisdictions. So we already talked a little bit about how every jurisdiction is going to have some sort of authority in the context of water access, water quality. When we're talking about the federal, state, local model, federal law is going to preempt state law. State could make more restrictive laws, more protective laws, so long as they're meeting the federal threshold. Local government laws are going to vary from state to state in terms of the breadth of authority a local government might have. But again, local governments are exercising delegated authority from states. And so you're going to have opportunities for preemption that come into play in terms of what a local municipality is going to be authorized to do under state law in the context of water quality regulation. When we're talking about the tribal level, things get a lot more complicated. In the context of water law, overwhelmingly, federal law is going to preempt tribal law. So tribes have to meet that federal threshold, but again, they can exceed it, they can expand it, they could govern more broadly if the federal government has, federal law doesn't govern that particular area. The reason I have this question mark here, because this is a part of my expertise in terms of federal Indian law and jurisdiction. When does federal law preempt tribal law. That in itself can be a really complicated question, but I feel I feel very confident and comfortable saying in the context of water law, federal law is going to be preempting here. And that's going to be the trend of a lot of legislative packages, regardless of the topic over the last few decades and the current federal courts dynamic. As a general rule, states and local governments exercising delegated authority from states are not going to have jurisdiction over tribal law. Unfortunately, the principles of federal Indian law in the context of civil jurisdiction, so anything that's not criminal, so that includes environmental law, that includes public health law. There are ways, tests that give a pathway for states to exercise some jurisdiction. As someone who hopes in her work to be a constant ally and advocate for tribal sovereignty and indigenous rights, I hate that the law says that, but that's just the fact of the matter is. So there can be certain instances when state law may apply in tribal law, but it's very fact specific, case specific, and often is going to hinge on litigation. So I would say my takeaway for you all is the general rule is state law, local law is not going to apply to tribes. And the only exceptions to that is if we have documented legal challenges and a judicial decision that says otherwise. And those might exist in certain areas that implicate water law, but our general rule is no. Just in the context of, again, lead, we have only in the context of environmental law, not getting into health and human services, not getting into Medicaid, not getting into occupational health and safety. We have about, quite a handful of federal statutes that are going to implicate lead in water. And this is that list. So we have to understand how these federal laws are going to be impacting actual water quality practice in terms of day-to-day, particularly if a state is exercising delegated jurisdiction to implement and enforce water laws, or if a state or tribe has more robust or rigorous requirements. These laws are regulating lead in paint and dust and soil and water and air and waste and cleanup. They're establishing a reporting system. And this matters because how does the lead get into the water? Well, because it's in the paint, it ends up being in the soil and in the dust and in the air, and then it seeps into the water supply. So you can't even, if we were talking about conducting legal research, limit your search to just lead and water in the purview of environmental regulation, because while lead in soil is absolutely going to have an impact, for example, in lead in a aquifer in our groundwater supply. So then every area that you see that the federal government has regulated, whether it's occupational safety, whether it's housing, which federal government does have laws on that, whether it is environmental law, you could see that also at the state level, also at the tribe level. And then there are often going to be certain things that are more frequently you're going to be seeing at the state and local level. So real estate disclosures in terms of lead-based paint use and houses. So for those that have bought and sold houses, there's often going to be a form that you have to sign that's going to be as a matter of state law. Certain testing requirements, both in terms of paint and soil and housing and daycares and childcare facilities, among a myriad of other issues. So hopefully you're seeing complexity and the layers that are coming in terms of, I care about lead. So how do I research what laws are coming into play? Just in the context of lead and tribal law, we have mechanisms for tribal implementation and enforcement of the federal standards. We have several tribes like the Cherokee Nation that have established their own lead-based management legislation. Tribal utilities are going to be testing for lead in their water supplies. And so the tribe might have regulations that come into play, but also be subject to regulations at the federal level and potentially state level. And they might have their own childhood testing programs. So in all of that, I decided that I want to focus just on one piece of this lead in water supply issue. And I decided to focus on childhood testing. So screening of lead in blood levels. So what does the federal law say? The Centers for Medicare and Medicaid Services has a state Medicaid manual. This is not a statute. It is not a regulation. It is an agency policy that isn't legally binding, but often is going to be interpreted as having the force of law. So what does that mean in practice? Even though it's not a regulation, jurisdictions are almost always going to hopefully be following it. So it feels like the law. So, and there's some case law that says it is legally binding, even though it's not a regulation. But I'm getting down into some law professor stuff that I will spare you all. So what does the Medicaid manual say? As part of our early and periodic screening, diagnostic, and treatment services, quote, all children enrolled in Medicaid are required to receive a screening blood test at 12 months and at 24 months. Children between 36 months and 72 months must receive a screening blood lead test if they have not been screened previously. A blood lead test result equal or greater than 10 micrograms per deciliter obtained by the capillary specimen, finger stick, must be confirmed using a venous sample. So in the arm. What are they looking for in terms of the standard for the micrograms per deciliter? 2021, CDC shifted their recommendations of the reference level. It used to be 5 micrograms per deciliter. Now it is 3.5, although there is no safe level of lead in blood. The blood reference level of 3.5 micrograms per deciliter in children is higher than most. So that standard is what providers are going to be looking for in terms of elevated blood levels. Okay, so that's our federal standard. Again, not statute and regulation, but pretty much states are following it. They're required to follow it. So then what do states do with this information? Recall that this only applies to children enrolled in Medicaid. Children enrolled in Medicaid. So what do states do? This is the floor that the federal government has set. Some states have what's referred to as a universal testing requirement. Regardless of the child is enrolled in Medicaid or not, children need to be screened for their blood lead level. Some states will expand the requirement beyond Medicaid population, but they don't make it a universal requirement. So they might say certain high-risk communities, and the state will, or the state agency will have to identify what high risk means. Some states have recommendations. Oh, physicians should be screening, but it's not required. So we're seeing now this, in terms of the rigor of the law, this model is almost the lowest. The final one is no non-Medicaid policy. No non-Medicaid policy. All right, so I want to ask you all, what does New Mexico require for childhood blood testing? So again, we have this federal threshold, Medicaid, enrolled children, 12 months, 24 months, so 2 screens with a catch-up period. 36 to 72 months if they haven't been screened previously. And then we have 4 models in which states have opted to regulate, establish policy in this area. Following the Medicaid policy at the federal level and leave it at that, make recommendations but not requirements, requirements but not universal, and then universal testing. So I wanted to give you all a few minutes and ask you to hop on, pull up another screen and see what you can find the answer to this if you don't already know it. And then even if you do know it or have a guess on what it is, I want you to still look it up in terms of how do you know it's required? What law is there on the books that says it's required? And does New Mexico have a universal testing? Does it have Medicaid only? Does it have Medicaid plus? Does it have recommendations only? So let's take, maybe 3-4 minutes and see what you all find out. And once you feel like you've got an answer, feel free to raise your hand and share what you found. And it's okay if you don't feel uber confident. That's all right. Yeah, Amy.
So I'm just looking at New Mexico Department of Health saying both federal and state Medicaid regulations require that all children enrolled in Medicaid be tested at 12 months and again at 24 months of age. Children between the ages of 36 months and 72 months of age must receive a screening lead test if they have not been previously screened.
Okay, so we've got this idea of universal requirement. Amy, can I ask? So you said you were at a state agency website, New Mexico. Which agency are you on? Which agency website?
New Mexico Department of Health.
Okay, are you
Wait, maybe not.
interesting?
Yeah, it's the New Mexico Department of Health Child-Led Poisoning Prevention Program.
Okay, and it's not what I've got pulled up.
Okay.
Is that correct? You're not looking at what I'm looking at. This is one page.
No, you want me to pull it up?
Oh, sure, yeah. Let's see what you got.
You just can't trust the internet, can you?
No, you can't. We'll talk about that.
Let me hold on. I need.
Okay.
Can I stop your screen sharing?
Yes, please. Do I need to stop?
Okay. No. Okay, there we go. This is what I'm looking at. That's New Mexico Department of Health.
Let's see. Okay, so we've got a Department of Health, so state agency website. Federal and state Medicaid regulations require all children enrolled in Medicaid to be tested at 12 months. Okay, so this looks like the same threshold as the federal standard, and it doesn't look that there's any extra requirements, so non-Medicaid enrolled children.
But I'm assuming.
Yeah, did anyone find anything that suggests that non-Medicaid enrolled children might be required or recommended? I'm going to show you.
Brenda has her hand up. Brenda, what
sorry.
did you
Let me see.
Okay.
Hey, Brenda.
I'm sorry, I'm having trouble switching back to Zoom from what I was looking at. But what I found was the similar thing, but at the very bottom it said all refugee children under the age of 18 must be tested upon entering the United States.
Yes. Okay, awesome. Thank you so much, Brenda. I found something similar too. So, not the same page that Amy had shared, but hopefully my website is showing up now. Yeah.
Yeah, you're good.
Good. Thank you. So, New Mexico Department of Health Childhood-Led Screening and Case Management Guidelines. So, they have language that says recommendations to healthcare providers, and then actions taken by the Department of Health. But if you scroll to the bottom, who should be screened? This is what Brenda had shared. All children enrolled in Medicaid, 12 months, 24 months, all refugee children 6 months to 16 years old at entry. Other at-risk children based on the judgment of the provider at the request of the parents. All right, so already just with government agency websites, we are seeing different language, right? I want to show you another page. This is another newmexico.gov webpage. What is the less testing program in New Mexico for children? Y'all, the first thing it says is, this is a universal testing state. Is it though? Because when you read on, it says, if a doctor or family member is concerned about lead poisoning, testing is available. So they're using the language that many in the field say universal testing is every child needs to get tested. And they're using it as, it's great if everyone gets tested. You should have opportunity. So it's not universal testing in the way we often talk about it. So this is 3 different sites, maybe, 4 if we include Amy's. This is really complicated. I went and pulled up the New Mexico statutory code, the New Mexico regulatory code. And I said, well, these policies are lovely. That chart's so helpful. Let me find out the actual governing law, the statute or regulation that establishes the requirement. And I was like, looking, and I couldn't find it. And I'll say, oh, this search engine, something's funky. It's not pulling up what I need. I'm doing something wrong here. Y'all, I went and verified from multiple other secondary sources. New Mexico's childhood testing screening requirement is not codified in the statutory code or the administrative code. So that means it's agency policy. And how do we find agency policy from the agencies? And already you can see that can be really complicated in terms of understanding the scope of the language. Another thing that I want us to think about, again, in the context of lead screening in children, is what happens if a child is tested with elevated levels. This federal standard that's implemented at the state level, that some states have expanded to make more comprehensive beyond the non-Medicaid population. So what if you test someone if there's not going to be corresponding treatment and services for the child and the family? There isn't going to be testing of their school, their water supply, soil, their homes, the paint. And so one thing I was on the lookout for in that particular chart, which I've linked in the slides, shows on the next column what the Department of Health is supposed to do after. Let me pull that up again at risk of muddling. So what are they supposed to do? A letter to family physician, provide educational materials, maybe open a case file, conduct an informal interview. This is based on how high the lead level is. Home visit, if it's at 45 to 69. So if the federal threshold's 3.5, that there's not going to be a home visit until 45 to 69. And the other reason this is so interesting in the context of New Mexico is, remember, this is not based on statute or regulation. So this isn't required. This is the agency policy. Is it going to be legally enforceable if the agency doesn't do this? Should the agency be doing more? Do they have the resources to be doing more? If it was codified in statute, could there have been then authorization and appropriation of funds? These are all really interesting legal questions that could be an area for exploration. But this is just for lead. This is just for lead. So let's explore in a little bit more detail developing research priorities. I know the team, the group has identified water quality as being the primary issue of vis-a-vis, let's say, water access. just in a matter of how things are regulated, I brainstormed a column on what are some water access issues. And then high level brainstorm, or what are some water quality issues? Doing legal research, prioritizing, potentially researching and then crafting a policy priority in the context of lead is going to be a lot of research and labor. But that doesn't include then salmonella or giardia, cholera, E. coli, Legionella, and a myriad of other issues, harmful algal blooms, shellfish, right? Oh, maybe less of an issue for you all. But that being said, it's probably too big. I mean, I can't tell y'all to do. I ain't the boss of nothing except my husband and my dog. Not so much my dog, actually. So I can't tell you what to do, but even having, 10 different health issues that are a concern might be too many. Because I did several hours of research just on lead. And not just on any lead issue, it was just on lead testing in children. Because we could have gone down a really, really ginormous rabbit hole of housing and school testing, soil testing at residential areas, soil testing at schools, soil testing at childcare. And then, we can, again, do that for every single different kind of issue. I, in my research and my practice, do a lot of work on public health surveillance. And so I'm always very interested in what the reporting requirements are for various waterborne diseases and any gaps in the reporting systems. So in any one of these issues, what is state law? And every state except for one, has a statute or regulation that list their reportable conditions and events. One state has it completely via agency policy, but every jurisdiction does this. Not every tribe, but many tribes also have reportable diseases and conditions. So are all of the issues that are relevant to you all in terms of a drinking water related health condition on the list? Is there something about the threshold level that might be too low? I don't know, but that could be an area of research exploration for anything that you've identified as a priority. One of the things I talk about with my health policy students a lot is, how do we know this is an area of urgent action? Do you have anecdotal evidence from members of the community? Are there news articles? Are there sufficient surveillance data? And so as you all are thinking about what water quality issues do I care about, what matters to my community and the people I'm serving, do you have data to demonstrate the higher rates? And if the answer is no, is it because the reporting system is flawed and there needs to be changes in the law and policy for reporting so that you have a better quality data or more robust data? Some of you all might have had a chance to watch the video from Temple on introduction to law and conducting legal research. One of the reasons that video is an excellent one that your colleagues selected was because it talked about publicly accessible databases to conduct that research. I want to invite all of us together, this group's small enough for us to brainstorm and conduct some initial searches on some water quality issues that you might want to see in terms of what the legal research results might entail. So I did a few screen grabs from my subscription-based legal database. I'll tell you a little bit more about some other databases that was also referenced in the video if you had the opportunity to watch it. But this screen grab shows, just in the context of a search for lead and just in New Mexico, there were nearly 300 statutes and over 300 regulations. Now, these databases are not perfect. Some of them are the search results are actually going to be about leadership. And so part of the challenges of conducting this research is you have to craft a broad search string and then cull through it to determine if that particular provision that got flagged is actually relevant to the research question that you have. So maybe lead is too broad. I did a search for lead and water. Now, I already want to caution you all, I already told you lead and water might be too narrow because lead in soil is going to impact lead and water. But if I do limit the search as lead and water, and again, just New Mexico, we had nearly 50 statutes and 60 regulations. So that narrows the field quite a bit. I did one more, lead in drinking water, again, just New Mexico, and it only cut down about a couple of dozen of the regulations. But again, this I don't think would be a really good search string because I coupled drinking water so that drinking and water comes together always. And that might not be something that would be in terms of capturing all the useful laws that you care about, that might be too narrow. But just to give you an idea of how imperfect these databases are, they can't just give you the ones that matter. Either you have to collect that information from someone else who did this research, or you have to go through each one of them. So imagine then what that might look like if you also want to do Legionella or Giardia or E. coli. I know that the team had sent a worksheet that could help facilitate brainstorming some of the priorities that you all want to tackle in terms of your legal research. And whether you've started that or jotting things down during this, or if that table doesn't serve you well, that's fine. But I'd like us to go ahead and let me pull up my preferred legal database. But there's also, and I'll show you a few other ones that are publicly accessible. And let's see what kinds of results we have, because I want to know what you all are thinking about in terms of water quality issues in your community. So this is Westlaw. It is a subscription database. One of the reasons I like it is because I was trained on it in law school and I had access to it in practice, so I'm most familiar with it. But it also is really easy in terms of much of my work is going to be across jurisdictions. And so I can do all states, or I can say, oh, I just want to focus on the Great Lakes states because of harmful algal blooms. And so I can select just those states. New Mexico has their own databases that under constitutional due process requirements, every jurisdiction has to make their laws available publicly. They don't have to make it available online, but in the year 2024, almost all jurisdictions do. Regulations can be a little bit trickier, especially if you want them to be most up to date. But New Mexico has a database where you can pull up the statutory code and conduct a search there. This is all publicly accessible. They have for their administrative code, so these are agency regulations, ways to conduct searches, or you can just click through the particular title that you're interested in and do a skim through. That works sometimes when your search string isn't finding what you need, but this can be really labor intensive because you might be going through thousands and thousands of regulations. There is another publicly accessible database that I am very fond of. It's hosted at Cornell Law School, and you can select every single state jurisdiction, and you can find both their statutes, so their legislative made laws, and their agency regulations. Sue Thomas is on the call. I know you've connected with her before. She's got really robust expertise in terms of local government law, and their local government law is not the hardest, because tribal code is actually the hardest in terms of accessing tribal code language, but it is wild, wild west. So depending on the jurisdiction, and not just the jurisdiction in terms of the state, but in terms of the municipality, whether they make their code available or not online, it can be, just depends. A lot of the counties here in Indiana, we've got 92, only make it available if you drive to that county and they can give you a copy. But I found a library guide at the University of New Mexico that talks about which jurisdictions in New Mexico have ordinances on which databases. Unfortunately, not every database is always going to be publicly accessible. Sue, I don't know if you want to add anything to that.
Yeah, you could start with that legal or muni code, but if you want to maybe just put in a Google search for your city with your state, so if a lot of cities across states, and
I'm so sorry, Sue. It's hard to hear you. I don't know if you might be able to yell.
yes, one of the things going on here is the next door neighbors putting in a driveway and it's incredibly loud. So I'll try to yell and I'll work for you.
Okay. All right. Sorry about that, Sue.
So the easiest thing is to try to put in your city, state, and just write the words municipal code. And if there's something online, you will get it. You don't have to go through the code or legal or any of that. But the thing I know from the research I've done for you guys so far is there are some cities and counties in New Mexico where they simply do not post the code, not even in PDF, something that's not searchable. But most of the jurisdictions in which you're interested, I think all but one city county is, I think, available online. One of the issues I've noticed, because I do a lot of work with about 450 cities in California, and they're, I think, up to maybe one, they're all online and they're all pretty easy to search. But that's not true in New Mexico. You need to go for all the cities in which you're interested. You also have to go to the county, and then of course there's a whole other issue of trial. But you're right; it's not very hard. It's more difficult to do local ordinances, and they tend not to be as well documented. Sometimes you can't find effective dates. You do the best you can do comparatively. But if you're persistent enough, you usually get something. I often call county clerks and say, could you email me something, even if it's just a PDF or something like that? And I usually get, as long as there's somebody on staff, usually get help. It's not that they're trying to hide it or anything. It's just, every city county does not have the same monetary resources to make all this stuff constantly available and to document in ways that legal researchers and lawyers would much prefer.
Thank you so much, Sue. So it is definitely a crapshoot in the context of localities. But again, constitutional requirement, due process, jurisdictions have to make their codes available. So state and local jurisdictions, federal law. This is not true for tribes. And unfortunately, we would have to do a whole extra session if we were focusing on conducting tribal research. But usually the best bet is knowing which tribe that you want to conduct research on, and then if they don't have it available on their tribal website to make a request to the tribe. But the federal constitution doesn't apply to tribes, and so there's not an obligation under federal constitution for tribes to have those available. Go ahead, Sue.
Our requirements is a question of getting people to adhere to the requirements and to have the resources to the requirements. So, that's what you can possibly do.
Thank you, Sue. Sorry, we're still having a little trouble hearing you.
I don't think I could do anything differently here. But,
okay, all right. All right. Okay, well, thank you. Even though a jurisdiction might be required to make everything publicly accessible, that does not mean it has to be online, as we've already talked about. It also doesn't mean it's going to be free. So I had to get my law librarians. I wanted access to some pleadings for a New Hampshire case about data surveillance in a public health emergency. And it cost over $100 to get all of the documents. Usually that was just a lot of documents, and oftentimes it's not going to be that expensive, but just something to keep in mind. For the rest of our time, I want to focus at the state level though, because at the end of the day, even if you're interested in crafting a local policy intervention, you have to understand the framework of what's happening at the federal and state level in terms of what's being required at the state level. Is there an action that a state agency can take that's going to get the outcome you want? Or is it going to be more politically realistic to go at the local level? And those analyses are going to be really variable in each jurisdiction and each legislative body. So I'm going to pull up Westlaw and ask you all, either hands up or unmute. What should I Google? What are you interested in? And if you have something in mind, can you tell me how it's been impacting your community, why it's a priority for you?
PFAS has been a big issue in parts of our state.
Yes.
I don't
Okay.
know if that's appropriate for this search, but it's because
Sure.
we've had a lot of military bases and things like that.
Absolutely. So first thing I'm going to do is, I'm going to search for PFAS because it's very common for jurisdictions to use acronyms, but I also want to get the scientific terms. So in a lot of these research assessments that I've done, done a variety of searches for each type of issue. Let's say I could do chicken pox and varicella. If we've got a combo vaccine like Tdap, you might need to search all three of those to capture all the laws because you could never quite know how jurisdictions are going to be naming everything. So let's do a search first with the PER and y'all, this is embarrassing, but
There's a reason it's called PFAS. That's the reason we call it PFAS, right?
Okay, let's see what, as written, how this, what kind of hits we have. And again, this is just New Mexico. So I'm going to contact types. Oof. Okay. Secondary searches are court rules. I've got statutes and court rules. So these are provisions that get codified from legislation. I've got 51, but look already, there was a problem with my search string because you can just see from the snippet that it is looking at the entire provision and it's looking for per and substances, even though they're not living together in terms of one term. So let me go back and put some quotations and see if that changes anything. Zero statutes, zero regulations. I think that this per hyphen is causing some issues. So let me take that off and see if we get anything. No statutes.
I'd love to be wrong, but I'm almost positive there's no statutes or regulations around PFAS in New Mexico yet.
I'm sure. I think that's what we're finding out. Let's do PFAS.
So there's
You're
actually no current federal jurisdictions on it. I'm in the wastewater treatment world, so I've spent a lot of time researching PFAS.
Nothing. Okay. Do we know of a jurisdiction that is regulating this? So if not at the federal level, California maybe?
Yeah, I was in
Okay.
California.
Okay, so I did the PFAS, a quick search under federal. We got a few statutes. Now, something to keep in mind in terms of policymaking, especially at the federal level, especially when we're looking at statutes. A lot of times, Congress or state legislature, they might not be ready to regulate. So establishing requirements of these are the limits that you can have in drinking water. This is the limits in terms of discharge. This is how, limiting the kinds of products that are more likely to get in the water supply. But what they will do is they will call, I call this the warm and fuzzy, touchy-feely kind of stuff, is they said, we're going to do research on. We're going to require the CDC to do a report on. So that is fact here because PFAS is hitting up in terms of statutory law. And the title of this provision is Interagency Body of Research Related to PFAS. And I'm always very quick to dismiss this because I'm like, they're not actually doing anything. But this is actually a great start because it's requiring agencies to think about it. And if the Congress doesn't tell them to think about it, they may do it depending on the leadership there, or they may not. So this requirement is telling the director of the Office of Science and Technology, it looks like this might be within the Department of Commerce. I'd have to go up into other parts of this particular section to see where this director lives. Through the National Science and Technology Council, shall establish, designate an interagency work group, and these are all the agencies that need to participate in. So maybe the body of scientific evidence, the body of government-produced evidence is still developing. Having a law like this is actually really great in starting the process of maybe legislating down the road. So something to think about in, let's say, New Mexico, if this is a priority, you know there's no federal regulations, you know the state agencies aren't going to jump on this, maybe in your jurisdiction. Indiana is definitely not a jurisdiction that likes to innovate until federal government does something. So this could be a good start. Well, while the federal government, we're waiting on the feds, maybe you agencies can start doing some research. Let's see what California's got. Okay, 24 statutes. So again, provisions coming out of legislative findings and declarations. So the way that legislative documents come out of Congress, whether it's state or federal level, there's a kind of structured framework. They have certain provisions at the beginning that will talk about findings and purposes and goals, so very warm and fuzzy, but they're not part of the operative provisions. Those come a little later, and that's what's legally binding. So legislative findings, declarations might say, like in the context of federal Indian health policy, it is the policy of the United States to ensure the highest possible level of health for American Indians, Alaska Natives. That's always in the legislative findings, and that is not legally binding. Okay, so here the legislature is saying, you know, we're enacting some laws that there's peer-reviewed research that is linking PFAS to cancers, hormone disruption, kidney. This is really important. So this helps then down the line if there's litigation about whether how to interpret some of the legal requirements, that some of these legislative findings can show and demonstrate the intent of the legislator in their subsequent provisions. I'm going to flip through in order because like provisions are often going to live together. This is the second one in this prohibition against cosmetic products that contain intentionally added PFAS, beginning 2025. So this hasn't come into effect yet. No entity shall manufacture, sell, deliver, hold, or offer for sale in commerce any cosmetic product that contains intentionally added PFAS. Now, I do not know the product reason for adding PFAS. Maybe it keeps your lipstick on there for longer, right? This is something that could be gleaned from some of the legislative history. What was there a committee report that was published? Was there a hearing when they were considering the legislation where a scientist talks about cosmetics and PFAS and why they're putting these products in? Is it to save money? That's often on the list. Okay, definitions. what's intentionally added PFAS. Chemicals that manufacturers intentionally added that have a functional or technical effect of the product. Chemicals that are intentionally break down products of an added chemical. I don't know exactly what all of that means, but regulated entities are going to need to. So this is super interesting, not that because California law is going to apply in New Mexico, but this is often how laws get passed in other jurisdictions. Is one jurisdiction, whether it's a local government, a tribe, a state, takes the lead on an area, and that ends up being a model or lesson learned, sometimes for good, sometimes for bad. All right, what else can I search for in New Mexico? Thank you so much, Amy, for PFAS.
There's arsenic.
Arsenic? All right, let's see. Angelica, is that something you're seeing a lot of in your community?
I it's something that I saw pop up as being a pollutant of concern within Bernalillo County.
Could you educate me a little bit? What are the health harms of arsenic and how does it end up getting into water supply? You or someone else? Or if anyone wants to Google and read it to me.
I'm no expert, but I know that some of it is supposedly naturally occurring in New
Right.
Mexico. But like I said, that's not my field of expertise. So, but I just know I've seen that, and even the naturally occurring is of concern, perhaps.
Okay, excellent. Let's just Google it. Conferred carcinogen with significant chemical contaminant in drinking water globally. Also occur in organic form, highly toxic.
I believe it's associated with cancer and skin. I want to say the word is lesions, but skin diseases.
Yeah. Why is this relevant for legal research besides trying to prioritize certain issues? Because it might be that the reportable conditions law isn't going to capture levels of arsenic in blood, but instead they're going to be reporting the certain types of cancers. But you all would know that those cancers are associated with arsenic in drinking water, or those certain skin infections, which depending on what they are, might not be reportable at all. And so that might be an area of, wow, if we just had a better idea of how frequent these arsenic-related infections are, then that would be really helpful for us. Okay, so let's see what we have learned about arsenic. New Mexico, 13 statutes. So pesticide control. Okay, evidently arsenic is a frequent ingredient in pesticides. So ingredient statement means a statement that contains the name and percentage of each ingredient, total percentage of ingredients. If the pesticide contains arsenic in any form, the ingredient statement shall contain a statement of the percentages of total and water soluble arsenic calculated as elemental arsenic. Okay, this is why this work is so important that it's done with an interdisciplinary body. I can conduct legal research. I do not know the difference between water soluble and elemental arsenic is. I mean, I can have like a gut feeling guess, but like, I don't know why that's significant as a matter of health. Is only the water soluble one going to get to the drinking water? Well, this matters. This is coming just from the definition section. Let's see if our results give us anything else about. Okay. Mine, so this is a completely different section of the statutory code. This is about mining, remediation, and restoration. And it's a study act. See, very common for legislatures to say, do research on this issue. And presumably this statutory, this article is requiring a certain agency to conduct research on toxic metal contaminants, and it defines toxic metal contaminants to include arsenic. And so that means, as a point of legal research, now that you know this, you have to do a search for toxic metal contaminants, because there might be relevant laws that are just governing toxic metal contaminants, but you care about arsenic. But if it's included in there, those laws might be matter to you in terms of understanding the framework and understanding how to regulate. All right, let's go look, maybe find a couple of more examples. Okay, so this is for public water systems. The Department of Environment is going to be testing for arsenic levels. Presumably part of this article is going to give maybe a time frame in terms of how frequently. If it doesn't establish what levels are safe, then maybe there's a regulation or policy, or deferring to federal standard in terms of what levels is going to be appropriate. All right, maybe one more quick search, and then I'm going to pass the baton over for any kind of questions, announcements. Actually, we only have a few more minutes. What questions do you all have for me? My goal was to make you all overwhelmed by how complicated doing this research is. So hopefully I've achieved that.
I am.
Thanks, Amy.
Well, I just want to say, Aila, thank you for walking us through this, because I know all of you have been kept hearing me say, like, water law is so large, but I hope that this kind of showed you just what I'm talking about, because this is what I'm seeing right on what I keep being told. And then I'm so thankful that you can show it to everyone to see just how vast this is. And how it's important. And I think one of the really important things about narrowing it down like this and making sure we're researching the right thing is that we'll actually be able to look at the impacts and really look at the laws, and not just have a whole bunch of laws that don't mean a lot, right? We can actually see what's happening, talk about specific issues, and see what we can do about those specific issues.
And this is where kind of the research process is so important, is identifying your health issue can really add a lot of structure to the research process. So if it's lead, if it is childhood lead testing, if it is arsenic, if it is PFAS, can local governments in New Mexico, can tribal governments in New Mexico regulate PFAS if federal and state law is silent? And that could be a really interesting exploration of that. I think Anthony had unmuted. Anthony, did you have any questions or want me to do a quick search on anything?
No, I don't want you to do any more search, because I'm already kind of overwhelmed by what you told us this afternoon here. I do have a couple of points, and one of the things that you had brought up was the statutes versus the policies, especially with the lead testing. And you mentioned DOH, you mentioned HSD, but I couldn't help but leave out the fact that all of these things are quite political in its implementation, maybe even its final use. First of all, DOH and HSD, which now may be called the new health authority under the governor's change of legislation, I don't know how the three are going to be even talking to each other to implement any of the statutory and the CMS required services. For example, you mentioned lead, And the first thing I thought of was, I am probably the only one that has publicly declared fraud on the managed care industry and telling them that they are committing fraud by promising all these services to our Medicaid patients, and yet they have not even done their first level of assessments to level them 1, 2, or 3, and can't find the people that are enrolled in their programs, even though they have received the money payment per month every month for the past 2 or 3 or 5 years. So your lead example was one where I thought of, true, you may have the requirement from DOH, and Medicaid is administered currently by the HSD department, Medicaid division. The biggest thing that I see in a lot of the statements you made was, who is enforcing it? Who in the state is enforcing these lead testing of all the MCOs to make sure that it's in the state's contracts, to make sure the MCOs are abiding by the 2 dates that you mentioned, the times when they should be doing the testing or assessments of these children. And yet at the same time, we just got recently a waiver from CHS to do all kinds of Medicaid work from 0 to 6. So I guess enforcement is an issue that I think really needs to be stood out and brought to the forefront. And now you have given me more ammunition and more information that I can use to convey some of these things. But more importantly, I think you brought out the tribes. And I think even for small tribes or bigger tribes or any tribes, and I would parallel that to a lot of the smaller communities, we don't have the infrastructure, we don't have the technical, scientific staffing, even water testing equipment that we have. I'll give you for an example. Currently, in Jemez Pueblo, my brother has gone through 2 water heaters because the water is so hard that it clogs up a lot of the pipes. And so who is monitoring that? Where are they sending those testing for arsenic, even for lead or whatever they're looking for in there? And there seems to be no rules or some kind of streamlined method of doing these things, not only in some of our tribes, but a lot of our smaller communities. So thank you for your presentation. I can go on to 3 or 4 other things, but I know we all have time that is valuable. Thank you. I appreciate it.
Thank you so much, Anthony. I'm so glad you emphasized that, and I want to amplify that, and that laws on the books are only as good as their implementation and their enforcement. And so a lot of provisions will have requirements. So mask mandates during COVID are a really great example, but don't actually have, they didn't have any meaningfully feasible enforcement process. Does that mean they're not worth it if there's no enforcement? Not necessarily. There's a lot of public health evidence that suggests the mandate alone is useful. But that's something that you have to think about. The other piece of this is a legal term called enforcement discretion. Agencies, whether it's law enforcement, enforcing criminal laws, if it is the Department of Health, the EPA, State Department of Environment, federal law, state law says that agencies have enforcement discretion. They don't have enough resources to enforce everything, so they get to choose. And so then that becomes part of the calculation too, as a matter of changing policy. I don't know what y'all's end goal is, but politics is part of this, because some things are just not going to pass the Indiana legislature or the New Mexico legislature, but maybe an agency policy could make a huge difference. Maybe just a requirement, even if there is an enforcement attached to it, is alone going to be useful. And so these are things to think about. Maybe Anthony mentioned contracts. Maybe there's something to be put into contracts that doesn't require any political body, no rulemaking process, no legislative process. Could a contract language provide more meat and teeth? And that's something that maybe is something to be explored. All right, I'm gonna pass it back, I think, to Rebecca to close this out.
Yeah, absolutely. Thank you, Aila. And I think that's what I think all of us have talked about is these laws are on the books, but how are they being implemented and who is implementing them? And I think that's especially prevalent when we're talking about local laws, right? And that's where I think we can make a difference in the way that they're implemented. are we going to be impacting federal water law with this little research project? No, but can we impact, like some of our local or state laws? I think it's possible, and I think we have the team to do it. So thank you for that. And the sobering reminder of the reality is a law can be there, but is it happening is the real question. So I put the survey in the chat. All of you know how to take it. You can just take that before you hop off. The only other announcement I have is that we are not going to have a training in April, but we're going to do an all-site meeting. I know it's been a while since we've done one of those, but we're still going to meet in April. My hope is we could probably talk a lot more about this. I don't know what you think, Monica, but I think that can really be a place for us to, I know this was a lot to take in today, but maybe that's the time we can actually process it, and look through and see what we think is really impacting our community. So definitely some food for thought before that happens, of what are we looking at more specifically, and what's in the water that is an issue, or what's causing bad drinking water that's the issue that we want to look at. And I'll just say now, and we'll probably say this again next month, but we are not feeling like, at least as the CHICA team, like the back end team, like it has to, like you all have to decide on one topic. We feel like we have the bandwidth to do a few different topics that people care about. I know we've kind of all filtered down, and you've all been very great about helping us, like get down into the same type of feeling, but we want to make sure, since these are so specific, that you really feel like what's mattering in your community is being looked at for this project. And as a reminder, you are not going to be expected to go and find those laws, pull them, analyze them, all of that stuff. So this is really just to show you what it looks like, to get you really familiar with, again, the research process, what it looks like to look up law. But we're not going to just send you an email one day saying you have to do this. Any other thoughts? Everybody wants to go process what Aila told us today.
Sorry, but thanks for the chance to.
No, thank you so much. And I think all good processing, at least for me, of just really being able to chew on this in a more tangible way. So thank you so much.
Thanks all. Looking forward to seeing you all again soon.
That was great. I appreciate it. Thank you.
Thank you.
Anthony. Give everyone a couple more minutes to finish their surveys if they need to. Okay. All right. Well, if anyone needs anything, feel free to reach out. We'll be sending out Aila's slides to everyone as well.
And I think we've got a meeting next week, so I'll see you all then.
Okay, perfect. See you then,
Bye.
everyone.